Hello and warm welcome to MedX, where we bring you the latest news and insights from the world of medicine. In vaccine news, a recent study has reaffirmed the high efficacy of yellow fever vaccine even at reduced doses. While a single standard dose remains highly effective, vaccine supply constraints have driven research into lower dose alternatives. A study involving 480 participants assessed whether lower doses of the yellow fever vaccine could still induce seroconversion within 28 days. The results were promising. A dose as low as 500 IU was found to be non-inferior to the standard 13,803 IU dose. A seroconversion rate for the standard dose was 98%, with minimal difference observed in lower dose groups. The 1000 IU and 500 IU doses showed seroconversion rates statistically compared to the standard dose, while the 250 IU dose showed a slightly reduction in efficacy. These findings suggest that dose pairing strategies could be a viable option to extend vaccine supply without compromising efficacy. The American College of Cardiology and the American Heart Association have released a new 2025 guidelines for acute coronary syndromes, bringing key updates to clinical practice. Ticagrelor or prasugrel is now preferred over clopidogrel for PCI patients, reinforcing a stronger antiplatelet approach. Dual antiplatelet therapy remains essential for at least 12 months with strategies to reduce bleeding risk. For lipid management, high-intensity statins stay first line with ezetimibe as an option and additional agent for high-risk patients. An invasive strategy is advised for intermediate and high-risk non-ST elevation ACS. Procedural updates including a preference for radial PCI and a recommendation for complete revascularization when possible. Secondary prevention including cardiac rehab and lipid monitoring remain crucial for long-term outcomes. A significant public health milestone have been reported by Centers of Disease Control and Prevention. Young women in the US today are significantly less likely to have cervical precancerous cells compared to previous generation, an achievement that underscores the impact of the HPV vaccine. The study spanning cervical screening from 2008 to 2022 highlights an approximately 80% reduction in precancerous cervical cell cases among women aged 20 to 24. This decline coincides with the US recommendation of HPV vaccination for preteen girls since 2006, supporting its effectiveness in reducing the risk of cervical cancer. Although the research did not directly link vaccination status with screening results, experts affirm that the timeline aligns with the vaccine introduction and widespread use. Dr. Jane Montialgre from MD Ederson Cancer Center called these findings reassuring, reinforcing the importance of HPV vaccination in cancer prevention. Qatar's Ministry of Public Health has officially announced the healthcare sector's working hours during Ramadan. Emergency and inpatient service will continue to operate 24/7, ensuring seamless patient care. Additionally, urgent care services at selected healthcare centers will be available around the clock to meet immediate medical needs. Government Healthcare Institute will release specific schedule for their services. Meanwhile, the Medical Commission Department will open from 9 a.m. to 5 p.m., while other departments including birth and death registration offices will follow designated working hours. To ensure uninterrupted support, the Unified Healthcare Contact Center will remain operational 24/7. A new study has revealed promising results for Tezepelumab in treating severe uncontrolled chronic rhinosinusitis with nasal polyps. In a phase 3 clinical trial, researchers evaluated the efficacy and safety of Tezepelumab in 408 adult patients. After 52 weeks, Tezepelumab demonstrated significant improvement across multiple measures. Patients saw a reduction in nasal polyp size, nasal congestion, and loss of smell, with all the results achieving statistical significance. Additionally, quality of life scores including the SNOT-22 and LM scores also improved. Most notably, the need for nasal polyp surgery dropped dramatically. In the Tezepelumab group, just 0.5% required surgery compared to 22.1% in placebo group. These findings suggest Tezepelumab could be a game changer in managing severe chronic rhinosinusitis with nasal polyp, offering a non-surgical and steroid-sparing approach. That's all for this week's highlight from the world of medicine. Stay tuned for more updates.